Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Okay, bleed risk classification. What is this bleed risk classification? It is a classification which is used to predict the risk of rebleeding and mortality in upper GI bleeding. In upper GI bleeding, this bleed classification will predict the risk of rebleeding and also mortality of the bleeding. So, it has actually 5 criteria. So, if you see the criteria of the bleed risk classification, so if the one B for ongoing bleeding, there can be low systolic pressure of less than 100 millimeters of Hg, elevated prothrombin time which is more than 1.2 times that of control, or there can be altered mental status and presence of uncontrollable comorbid disease. So B for B bleeding, L for low systolic blood pressure of less than 100 millimeters of Hg, E for elevated prothrombin time which is more than 1.5 times the control, and E for altered mental status, and D is for disease, unstable comorbid disease. So this is bleed classification.
thank you and thank you for watching.